Hey guys, what's up? It's Aaron here with Iron Therapy Training, and today I'm here with Alisa Galindo, and we have a special topic today. We're going to talk about muscle loss or independence loss, and then we're also going to talk about how you can help protect yourself and fight back to keep your independence. And Alisa here, she's our brand ambassador. She works as a physical therapist assistant, and I'm gonna let her introduce herself and kind of what she does, so you guys can have a little better idea, and then we'll kick this talk off, okay? So Alisa, tell them a little bit about yourself.
So I'm Alisa Galindo. I am a physical therapist assistant. I've been practicing now for over 26 years. I've practiced all over Kansas, Colorado, Nevada, Washington State, and Hawaii. I've been in the Great Bend area now since 2022, and I currently work full-time at Golden Belt Home Health and Hospice, and then I also work at Azria Woodhaven Healthcare Woodhaven, out on 96. It's a skilled rehab facility and long-term care.
Okay, so you deal with on a day in and day out basis with some loss of independence, I'm sure.
Oh yeah, absolutely.
Okay.
Absolutely.
I'm curious because I want to learn a little bit more, and I know others do too, but I mean, what does that look like for you on a day in and day out basis with someone who loses their independence?
So someone that loses their independence, they can go from where they were walking independently without an assistive device such as a walker or cane to where now they're in a wheelchair and they can't even get up. Sometimes they can't even get into the wheelchair without using a mechanical Hoyer lift or a lift that assists them to where it transfers them once it's set up into the wheelchair. Then we go in and we work with them in therapy, and we try to get them back to their functional independence and mobility as much as we can. It just depends on the severity, how long that person was down for, what exactly the diagnosis was. That can all have factors into it.
Yeah, and so when they're having that trouble, like getting in and out of those chairs and moving around, I mean, from your point of view and what you've seen and heard probably from doctors and higher ups and people that you're around and the physical therapist you're working underneath, what do they see that's causing most of that?
Most of it is muscle loss.
Muscle loss?
Yeah, muscle loss is a big majority. You know, it's kind of like when you don't use it, you lose it. That is key. That is so true. I've had people that come in there and then they don't want to get out of bed because, you know, they're either not feeling good or they're in pain, but that's actually the worst thing that they can do. They say on average for every day that you lay in a hospital bed or lay in bed, you lose an average of 7 days of strength.
Oh, wow. Holy crap. I didn't even know that. You know, imagine just losing your strength that quick.
Yeah, it
just
doesn't
in that
take
amount of
long
time.
at all.
Wow. So on the working out side of it and strengthening your muscles on our side, what we know is, you know, sarcopenia starts usually around your 50s and 60s, but they're starting to see signs when people are hitting sarcopenia, you know, even in their 40s. They're starting to see the signs of it, okay? And here now with the way, you know, cell phones are, everything's automatic. They got electric scooters, electric bikes, everything's automatic. People are doing less and less. Those numbers are going to start coming down more and more where they're starting to hit that muscle loss and sarcopenia. So once they hit sarcopenia, that's the muscle wasting and bone degenerating disease, sarcopenia is, and it's the muscle loss. And when that happens at a faster rate, when you're 50s and 60s, that's when you're losing most of your strength and muscle. Being able to go up and down the stairs gets more challenging. Mm-hmm. Getting out of a chair gets more challenging. Getting out of bed can be more challenging. And that's where it starts. So what you need to do is make sure that you're resistance training at as young of an age as you can, to protect your independence and muscle and strength all the way throughout the rest of your life.
Absolutely.
So you can really get that taken care of. So on your side, do they have bone density problems inside there? Do you notice, like, do they mention that a lot?
Not as much as, like, unless there's like a fracture or unless it's a non-healing fracture. Not everybody goes and gets a bone density scan unless there's something going on where it's not healing correctly. Then they go in and get a bone density scan. But there is a lot of osteoarthritis, osteoporosis that I see with people daily.
Yeah, yeah. And the osteoporosis, do you mind mentioning a little bit about osteoporosis, what that kind of is?
Osteoporosis is basically where the bones lose their calcium or don't have enough calcium on them so that they become brittle, very brittle. I can give you an example. My grandmother had osteoporosis, and she could just reach out her hand with a loss of balance and she would break her wrist.
Wow.
Yeah.
Wow. Yeah. So that's really soft bones.
Yeah, very soft bones.
And I've heard that before. I'm not sure if you have heard it before, but they mentioned, like, did your hip break and cause the fall, or did you actually fall and break your hip?
Yeah.
You know, how true is that? Have you heard anything like that?
I've had several people that's happened to, where we're talking to them and I'm like, okay, so you fell and you fractured your hip. What were you doing that caused the fall? And sometimes they'll say, I was just standing there and all of a sudden I heard a pop and then I went down.
Oh man. Yeah. Wow. Wow. So that's really soft and brittle bones. And I did some research. I've been doing a lot of research. We're taught a lot of these things through the National Academy of Sports Medicine. And the loss of bone density, you're right, it is with like the calcium, deficiency, but that's not the only thing. Low vitamin D levels is what can cause the calcium to extract out of the bones quicker. Because without the vitamin D, you're unable to absorb the calcium inside the bones, inside the body. So vitamin D is a pro-hormone. It's a really, really one of the biggest vitamins that people have been known to be really deficient in too. You want to check your levels with the doctor, of course, because vitamin D can hurt you if you take too much. But having low levels of that causes severe problems. Bone loss, muscle loss, cognitive thinking loss in your brain. So it's a really big vitamin in our body, and it is a pro-hormone. So with that happening, if you're low in vitamin D and you're losing the calcium out of your bones, then you hit at, later on in life, you start having a little bit more trouble with your hormones.
Yeah.
So they call it andropause in men, where men start lacking, the normal production of testosterone, and women hit menopause. And when they hit menopause, they start losing more estradiol. And when the estradiol starts depreciating, they start losing more bone density quicker. So with sarcopenia going on, and then you're losing your hormones at an older age as well, that's not helping with the bone density and muscle loss at all.
Right.
It's speeding that up. The only way to protect yourself is you have to do resistance training. You have to have resistance on the muscles and bones to get the bone remodeling, to get the bone to remodel and increase the bone density. The good news is you can do this at any age. That's the good news. It's not too late. The studies have shown even at an older age, you can still increase your muscle mass and bone density with resistance training or high impact training. Walking and cardio alone won't do it.
Yeah, absolutely.
So on your side, you preach this a lot. I hear you come in here all the time, like, you need to keep doing as much as you can. You need to do this, you need to do that. I've heard the
getting
stories.
Frustrated with my patients because I'll be like, are you doing your home exercises? Yeah. And I'm like, okay, can you show me them? I need the sheet. And I'm like, okay, fine, we'll get the sheet. Now, can you show me them? And then you find out, you can tell if they're not doing it. Now, I have some patients that, yes, I'm doing it every single day. And the other thing that I preach to them, and I say, okay, once you're discharged from therapy, this is on the home health side, once you're discharged, you need to continue to work out. You can go to outpatient to get a little more independence, a little more balance. They have more machines for cardio, different things like that. But you've got to keep moving, because if you don't, what will happen? You'll lose the strength and you're going to be right back in the shape that you were, if not worse.
Yeah, gosh, dang it, yeah. And I've done a lot of research on that. That's another thing I've been, because I'm trying to figure out what the problem is. Where's the problem and how can I solve this problem? And I have found out it's the lack of accountability.
Oh, absolutely.
It's the lack of accountability. When you're there with them, they'll do the exercises.
Yep. And that's what they tell me. They're like, well, I like you here because you help lead it and you help do it with me. And I'm like, I can't be here all the time. I
Yeah.
have a lot of patience, and and I can't be here forever. Insurance is only going to allow me to be here for so long.
Yep. Insurance is only going to pay so much, guys. You have to resistance train. And I always talk about this a lot too. You have to invest in yourself. It's okay to spend money on yourself. It's okay to put the money in yourself. A lot of times people, they'll invest in everything else, or they'll invest in their kids. They'll invest in a person trying to get off drugs and go to rehab. But when it comes to themselves, they don't want to pour money into themselves. You have to invest in yourself. It's okay. The insurance companies are not going to pay for you to get healthy. They're not. They're going to get you just about good enough and they're going to release you. They're not going to pay any further than that. And once they release you, like Alisa said, they send you home with a list of exercises. They tell you, oh, just continue doing this and you'll be fine, which you will if you continue doing it. But what happens? Most people don't continue doing the exercises and they end up back at square one.
Right. They have every intention. They always tell me that. I have every intention. I just get busy during the day. I'm like, okay, well, let's do this. Let's try and see when you can do those exercises. How about around breakfast time, or around lunch, or around evening, because then you've hit it 3 times. The other thing, I do practice what I preach. I go to the gym on a regular basis, and my patients know that. They know that I work out. As soon as I leave work, I go work out, and a lot of people will be like, well, I don't know how you find the time. I make the time.
That's good.
Because it's important to me.
You have to make the time. That's part of investing in yourself too. You have to make time for yourself. You got to have you time too.
Yeah.
Okay, it can't always be about everybody else all the time. Because I've studied a little bit on that area as well, and that comes from a release of endorphins in your brain that you actually get from helping somebody else. Makes you feel good helping other people. But you have to take care of yourself too, because if you don't take care of yourself, you can't help other people. And then you're going to end up losing your independence later on. So I wanted to talk a little bit about the brain, the brain decline. There's a lot of mental decline as well inside there.
Absolutely, yeah.
Tell me that. I'm interested.
So what I see is that I see people are starting to get down because, I used to be able to walk. I used to be able to do this. I can't do this anymore. And I try to explain to them, well, you've had an injury and that's why, but we've got to get you back there. The other thing, you see that depression, and then when you see the depression, they don't want to get out of bed, they don't want to move, they start to get weaker again, you're trying to get them up out of bed. With the dementia, you'll have patients that can't remember, did I eat this morning? That's when it's really bad. Or did I do the exercises? Or you may have just finished therapy and they come right back in and they're like, hey, are we going to do therapy today? And I'm like, we already did it. It's okay. Well, I can't remember. I'm like, that's okay. So some things that you can do to stimulate the brain and get the neural synapses in the brain going is mind teasers, Sudoku, solitaire, putting puzzles together, a memory game. Those things will get the synapses going to try and help with the memory for them.
Yes, that is really good. Oh my gosh, I'm glad you brought that up. So, yeah, you have to keep challenging your brain just like you challenge your body.
Absolutely.
To keep going, to keep up with everything. If you don't keep challenging your brain, you're going to lose it. You have to keep challenging it. So with exercise, it's the same thing. It can help with your brain function, okay? When you exercise, it hits the prefrontal cortex of your brain. That helps with your rational thinking, reading, writing, and a bunch of other things. But it also makes your hippocampus bigger. And your hippocampus is a big part of where your memory comes from. Okay, so when you're exercising, it increases your hippocampus, and you can have a larger hippocampus. Some athletes have the largest hippocampuses. And then also working out challenges your cerebellum. And your cerebellum is where your balance and coordination comes from. So when you're working out and challenging the body sends signals up to the brain, to the cerebellum, to help it balance and maintain stability so you can move and function at an older age. And with the brain puzzles and doing those things, it's really important, like reading and writing. Just reading and writing alone can help your brain function. You have to watch how much you're staying on, like social media and
or your
screen time, video games and things like that, because that's where that brain is degenerating. You're losing your brain power through it. And they've talked about this way back in the 90s when I was a kid. Don't watch too much TV. You're going to get brain rot.
Yeah,
it's true. So. With the brain, also, you were talking about Alzheimer's and dementia. Do you have any more that you've noticed with that, with people? Like, does their, brain ever not want to let their body do certain things or anything like that? Or what do you notice with the brain and the movement?
So Alzheimer's, it's degenerative. And they'll decline to where the end stage is where they're almost like a baby, and they can't remember how to get out of bed. They can't remember to go to the bathroom.
Oh.
It's awful. They can't remember anything, and a lot of times they kind of quit talking too. Dementia's not as bad. I mean, it has different severities, but again, like you were saying, like the best thing you can do is just keep them moving, keep them getting up, and I have to have a lot of patience throughout the day with my patients because I'll tell them, okay, I'm going to have you get up 5 times from the chair, but I'm wanting them to push from the chair just for safety reasons and lean forward and then sit back down. Well, they'll try to grab the walker and pull themselves. No, push from the chair. And then you do it 5 times, you let them take a rest break, and then they do it right back again and they try to pull back. But you just have to keep repetitive, and then they'll remember finally because it will become ingrained in them.
Okay. Yeah, so I have some supplements and stuff that I know about that can help with the brain function and your brain. And these are some things that have been known to get low in people that cause that brain trouble. I mentioned one earlier is vitamin D. So definitely go check your blood work, guys. Go check your vitamin D levels. Go check your B12. B12 is a big one for the brain. That's more of an energy vitamin too. And then there's also fish oil, okay? Fish oil with DHA in there. That really helps with the brain power and your brain. And then another one, this is newer research, and they're still doing a lot of research on it. It's creatine. Okay, creatine has been known to help with the brain. They're still doing some research on it though. And what they're finding out is that the creatine's helping with the brain through the energy, because your brain uses a lot of energy. So if you're taking creatine at an older age, it does help with brain function through the energy side. Creatine works through your ATP-PC system, which is your energy system in your body. And since your brain uses all that power, that's where they're seeing the benefit. Because when you're boosted with creatine, you're able to work out for longer durations. You're able to lift heavier weights. You're able to do a little bit more than without the creatine. And that's the benefit that they're finding in the brain. So definitely do your blood work, check your vitamin D levels. Vitamin D, I'm telling you, is one of the biggest ones. And then vitamin B12, fish oil, and some can even benefit through creatine. Always, check with your doctor on all this just to make sure you don't have anything interacting and that you are actually low on these levels. But that's something that they've been seeing in older people with the brain loss as well.
Yeah.
So the body losing the strength and not being able to do their functions throughout the day. Do you see a lot of injuries in there? Do they have like rotator cuff tears? Do you have a lot of people that are hurt?
Yeah, a lot of rotator cuff tears. And sometimes they don't want to get it repaired because they're older and they're like, no, I'm not going through another surgery. But then that's going to hinder what they're able to do if they do have a rotator cuff tear, because if you're wanting them to do like a overhead press to work on some balance, but they have a rotator cuff tear, they're not going to be able to. Like a overhead press to work on some balance, but they have a rotator cuff tear, they're not going to be able to. So you have to modify the exercise and activity to what their tolerance can be. And I always tell people, you know, it's not forever. We just have to keep working on it. We're gonna get you stronger, get you more independent, but we have to do it every single day.
Yeah.
And the most frustrating thing for me is when I go in and the patient's been laying in bed all day and they're eating in bed. Is a pet peeve of mine. Do not eat in bed because you can actually aspirate and choke. And so I'm like, we need to get you up. You need to be sitting upright. You need to be sitting up for at least 30 minutes after you eat so that the food can digest properly.
Yeah, wow. There's a lot that goes into that as you get older and
Oh yeah, so
losing
much.
losing that independence. I didn't even think about them losing their independence to a point where they don't even want to sit up and eat.
Yep.
That can cause some serious trouble, you know, choking on your food or.
Oh yeah, and then the muscles are just going to atrophy even more, so that way you can't get out of bed. You can't even sit up on the side of the bed without me assisting you. You can't even get up from the lying down position, from the supine position to sitting edge of bed without me like helping you, scooping you up, and then me putting my hand behind your back, because you don't have the core muscle to hold yourself in place against gravity because you've been laying in bed so long.
Wow.
And then they have a tendency, if they've been in bed for a long time, they have a tendency to what's called posterior lean. So they like are pushing back because that's what their body feels. They feel like they're gonna fall, but they're actually pushing back because they're so used to lying flat.
Wow. Wow. Yeah. So laying around and stuff definitely too long isn't helping at all.
Not at all.
So the only way, guys, that we're really getting to here is like the only way to really protect yourself is with the resistance training. Make sure you're resistance training. Make sure you're checking your blood work, keeping up with like the vitamins and things that can help boost your brain health. Staying strong and mobile so you can prevent injuries and not have, you know, all these rotator cuff tears and knee trouble and hip replacements, because usually when all that stuff starts happening, guys, it starts going quicker.
Yeah, it goes very fast.
It goes fast. So that's another thing I wanted to ask you about is when they lose their independence like that, how fast are you seeing it progress?
Pretty fast. Like I said, the biggest one is when they're in bed. The other thing that can happen, they can get pneumonia, and then they're not able to get up out of bed by themselves. I have seen it to where a person where they were walking a week ago, but then they had a hip replacement because they fell and they broke their hip. They come back to the nursing home, they're not wanting to get out of bed because of pain, and now we're in a wheelchair, and then we're using a full lift to try and get them up, whereas 3 weeks prior, they were walking independently throughout the facility.
Yeah, wow.
So it doesn't take long for that muscle to weaken. And
that goes back all the way to what you said with the tell me that again, was it 7 days?
So for every day you lay flat in bed, you lose an average of 7 days of strength.
Yep, that goes all the way back to what you started with right there.
Yep.
That's how quick it happens. And people have probably seen it, you guys have probably seen it, where, you know, someone got hurt or grandma got hurt or grandma fell, and the next thing you know, she declined very quickly after that. Or right after that surgery, they decline even quicker. So make sure that you're keeping up with your strength, your mobility, and resistance training, and challenging your brain and body so you can continue with your independence and prevent yourself from having to have, you know, retirement center care or ending up in a nursing home. Well, this is Aaron here with Iron Therapy Training. Thank you, Alisa,
Thank
for
you.
talking today. This was a great talk on muscle loss or independent loss. We covered things about the brain health. We covered about staying strong, keep challenging your brain, and what the loss of independence looks like. So if you guys have any questions, don't hesitate to reach out. This is Aaron here with Iron Therapy Training. We'll see you soon.